Private hospitals will on Monday suspend Social Health Authority services due to unpaid dues. This follows the failure by the government to settle debts accrued by the defunct National Hospital Insurance Fund and challenges in SHA compensation. The Rural and Urban Private Hospitals Association is now calling for the 30 billion shillings owed to hospitals and the streamlining of the compensation of outpatient services under SHA.
A crisis is looming in the health sector if a threat by rural and urban private hospital associations to suspend services for patients under SHA starting Monday is anything to go by.
We deeply regret that from Monday, 24th of February 2025, patients seeking care under SHA will need to make cash payments at private hospitals across Kenya. The SHA outpatient reimbursement model, which proposes to pay a hospital less than 75 shillings per patient per month, is completely unrealistic.
According to the Private Hospitals Association, the government has been unable to address critical challenges, hence making it difficult to sustain hospital operations.
89% of hospitals reported that the SHA claims portal remains non-functional, making it impossible to process reimbursements. 54% of hospitals have not received any payment from SHA since December 2024. This situation is worse in our level 2 facilities.
Unpaid claims by the now defunct NHIF dating back to 2017 are also a cause for concern. According to RUFA, there is a high turnover of medical personnel due to hospital inability to pay them.
We have had massive job losses. Many hospitals have lost doctors, nurses, and support staff due to inability of these hospitals to pay salaries. Number 2, hospitals are facing bank defaults.
This development comes as the caucus of health sector unions and associations have accused the government of planning to merge their regulatory bodies.
We stand here to resist any proposal to merge healthcare regulatory bodies, which ought to stand alone and ensure that we strengthen our training and also the practice of professional in respect to their line.
Training is cadre specific, practice is cadre specific. Now you want to bring in a stranger, you want to merge about 18 health professionals to be regulated by a stranger.
The ministry and the parliament must drop the issue of declassification, defunding and merger with immediate effect and in totality. And if they do not do this within the next 14 days, then all of us shall issue a strike notice and proceed on strike.
Meanwhile, nurses under the Universal Health Coverage Program drawn from Busia, Kakamega, Bungoma and Vihiga took to the streets over failure by the government to absorb them on permanent and pensionable terms.
5 good years unafanya na watu wenye wako PNP. Wewe mwenyewe uko tu hapo contract. Hakuna kitu, yani unapata peanut.
Universal healthcare will not be realized if you are not employing these nurses. We are saying, please don't bring in any other nurse. Yet these ones already they have the experience.
Similar scenes were witnessed in Kutus, Kirinyaga County.
Now we are here demanding that we need our permanent and pensionable terms. We also need our salaries to be harmonized per the SLC laws.
We have tried to engage both levels of the government, but from what we understand, the county government do not want the UHC staffs to be absorbed to permanent and pensionable. Yet they want us to continue offering services to the same counties.
The nurses were among 8,500 health workers across all cadres employed in 2020 on contractual terms to advance the universal health coverage agenda and aid in the war against COVID-19. Nancy Okware, Prime Edition.